First question I had was just why is it not surprising that we're seeing the numbers we are seeing?
I mean, I think, um, and when you say this, you're specifically talking about the why there's more twice as many white people as Latinos being vaccinated. I
Mhm.
think, well, I think there's some broader issues and barriers that we still have to deal with here in California with regard to getting the vaccine out. There are some obstacles that many people have in many communities um, there are real obstacles to getting the vaccine, very practical obstacles that many people have, issues of time, of transportation, of technological literacy. Those are things that disproportionately impact lower income communities, communities of color, seniors. I think if you have to spend a long time on a telephone or have to go through an online portal to get coverage, that's gonna to get if let me repeat it. If you if you have to go through an online portal or wait through a telephone tree in order to get an appointment to get a vaccine, that's going to privilege some folks and disadvantage others who may not have the same time or technological literacy or other abilities to go through that system. Uh, the, there's issue when you look at who has access or to the vaccine. There are easier pathways if depending on your income, your insurance, and your immigration status. Then uh, I think a lot of the vaccine is being done through medical providers, and so for those of us who have a usual source of care, we may be getting a couple of phone calls and emails and communications from our health plan, from our healthcare provider. But if you don't have a regular healthcare provider, if you're uninsured, if you're even if you're insured but don't have that usual relationship with a doctor, then um, you may not be getting those same efforts at outreach. Somebody bugging you to say, "Hey, you should come in for an appointment right now." So I think that there's those issues that we have to deal with in this vaccine distribution. There are those barriers that we need to um, address, and frankly, there's proactive efforts we need to do to really reach into these communities that are maybe not as focused on the particulars of where the vaccine is available and how to get an appointment. Um, I would also say that there is a specific issue with regard to the ramp up, which is that as a state and frankly as a nation, we prioritized uh, healthcare workers and folks in nursing homes, and by definition, that's going to skew in a certain direction with regard to race, ethnicity, and other issues. As we broaden those categories to um, uh, starting with seniors, but going down the age range, as we start to broaden to include essential and exposed workers, then that should have some leveling effect because, as you, for example, do essential workers of teachers and food workers, and that will have a more diverse bent than if you're just focusing on healthcare workers per se.
You covered two, if not three, of my
Oh, sorry.
questions. It's all good. No, it's great. We're getting things done.
It took me a
Um,
second to rev up there, but okay.
what are some of the ways that, as a state, we can work to change and improve upon the vaccine rollout?
I think we can certainly. I think the key thing we need to do to have both an equitable and efficient rollout is to be in the communities that represent the diversity of California. It's not enough to do it at these mass vaccination sites, which are very important. The Dodger stadiums, the Cal Expos. We also need to be in the community because uh, that's where people are, they work, they live, and that's where it's most accessible for people to get to. I would say we need to make sure that getting a vaccine is both in time and places that are convenient. So that means after hour um, uh, sessions and abilities to get appointments that are not just 9 to 5. I think many will be getting it through maybe again the hospital or health system that they're used to, but others will need additional venues. And frankly, we may even need to do additional proactive efforts that include pop-up sites and even door-to-door and other innovative approaches as well. This will get easier when we get more supply. One of the things that's been hampering us right now has been the fact that we have a fairly strict and scarce supply of the vaccine. As we have more of it, then I think that will allow for broader outreach efforts that can get into further into the communities that are the particularly vulnerable to this public health crisis.
Now, here at ABC 10, we ask viewers to text us their questions and let us know what's going on. And we've had several people text in where they're from lower income communities like South Sacramento and are minorities and meet the criteria because they're 65 plus or whatever. And they're having a hard time getting the vaccine. I know a lot of that has to do with the supply and availability of appointments, but they are also seeing that there's not many clinics or not many vaccination sites near them. What advice would you have for some of our viewers that are experiencing that?
I would certainly recommend for people who are in some of these in these qualified categories and are eligible to get it. I would encourage them to do so and to be uh, patient but also persistent. That not everybody is available to get a vaccine immediately today. I mean, there's over 15 million Californians who are eligible in the current tier that we're in to get coverage, and we've gotten maybe 8 million supplies sent to us to date, and that's one dose, one of a 2-dose package. So we're going to need tens of millions of more doses to be able to even get to the people, everybody who is potentially eligible for coverage. That being for vaccination. That being said, I think there is. So while people should be patient, they should also be persistent. They should, if there is one clinic that is not taking appointments, there may be other opportunities. If they look at a slightly broader geographic reach, if there are resources available to help people with transportation and otherwise, there are. Um, um, if there is a uh, if there is a block today, it may be that there is an opening tomorrow or the next day, and people should not be afraid to sort of put in that inquiry. And sometimes you can set up an appointment for several weeks in advance, but it may be that there is a pharmacy or a vaccination site that has some openings in the next few days, and so some of this is um, trying to look at the various different obstacles. It's not unlike at this moment. There's some similarities to how people get the flu shot, which is that you can get it at your medical provider, but you also can get it at a pharmacy. You could also potentially get it at a county or pop-up site or a special event, and those are all possibilities. One of the things that the state is trying to do is to centralize this so that so that people can have a central place to go through the My Turn um, portal to find out what is both whether they're eligible, but also what the opportunities are if they are eligible, especially in their area.
Well, that's all the questions that I have. Is there anything that you think we should add in terms of vaccine inequity?
Just, I think, this is a really, I think it's in all of our interest. It's in all of our interests for this vaccine distribution to be efficient and equitable. We want to make sure that uh, the most vulnerable folks are vaccinated, because it's in all of our interest to prevent outbreaks, to prevent a strain on our healthcare system, to prevent a shortage of ICU beds for whenever I or anybody else may need one. So we all have an interest in making in preventing outbreaks, and getting especially the most vulnerable communities to be vaccinated, and to prevent the outbreaks that um, will impact us all. We're looking to try to, if we're trying to reopen and try to recover, we need all communities to be covered, including those that we're going to need to make some special efforts to break down some barriers, and to really make sure that they're covered, uh, I, along with the rest of us. And so that's I think that's just the main point, is that it's we need efficiency and equity, not just for the communities that we're outreaching to, but for this recovery to work for all of us.